Senator John Hoffman is the ranking minority member of the Senate Human Services Reform Committee. He joins me in the studio to offer his perspective on the challenges facing Minnesota's nursing homes. Thanks for being here.
It's great to be back, Shannon. Nice to see you again.
Yes, very nice. The concern among nursing home administrators is that the federal mandate that is about to take effect that requires healthcare workers and other staff to be fully vaccinated will result in the loss of quite a lot of critical staff. In your view, will the mandate result in unintended consequences, making nursing home residents lose critical care or perhaps even nursing home closures?
You know, I'm glad you bring that up because we had a hearing just last week, I believe, where some folks in the industry had brought up the concerns, right? And there's a couple of things that lay out there. There's an issue of choice, an issue of informed consent. There's an issue of informed, what are you telling me? What should I be doing, right? There's still some not good guidance from people about what it is you want us to do, right? And that's what they're telling us. And so we're sitting back asking that same question. But what we do know is we have a lot of people that need to be taken care of in the state of Minnesota. Of course, it's the first time in the history that you have more people 65 and older than you do in K-12 education. And the cost of that associated to on the Medicaid side goes from $1.1 billion to $3-some billion, right? What does that tell you is there's a huge gap, and that means we need bodies to help other people, especially taking care of other people. And so is it going to have an effect? It might, you know, how big of an effect, but that's really not the issue. The real issue is there's 23,000 to 30,000 open positions in some of these nursing home facilities. What are we doing to change our system and change our approach on how we're going to fill those slots?
So what you're saying is that this problem that we're facing that is sort of coming to a head because of this mandate from the Centers for Medicare and Medicaid is just the tip of the iceberg. I mean, we all knew that there were workforce shortages long before this, but this is creating that critical nature of getting enough workers to care for our elderly and vulnerable people. Is more money the solution?
You know, we do know that in the industry of home and community-based services, our Medicaid reimbursement rate for folks doesn't work. I'll give you an example. There's an organization right now, there's 12 little kiddos that are in 2 different hospitals, right? And they're ready to go home. They need to go home. But because that organizations cannot find nursing folks, nursing services people to work for them at a market rate, the youth have to stay in the hospital. Well, it's costing the system more to have these kiddos in the hospital than it is to get them home. And if that is an issue, particularly in this case, it's a reimbursement issue. Our Medicaid reimbursement in Minnesota is absolutely not on par. When you know if I go work for a home health agency, I'm going to make, you know, X amount of dollars. I can go across the street and work at a clinic for $10 to $20 more an hour as a nurse. Something's wrong with that system. So one sense you're asking, is more money part of it? Yeah, it is. It's to elevate it. I'll give you another example. A senator from central Minnesota got a letter from a constituent who happens to run a personal care PCA business, right? And which we know home health care, part of their piece is a PCA. And they're starting people at $14.40 an hour because the reimbursement rate isn't where it should be. And in that same town, you can go to work at Kentucky Fried Chicken. I was in St. Francis the other day, $16 an hour starting. So it's like, yeah, money needs to be helpful in this. But the other thing is we got to talk about reform. Is our industry needing to evolve to something that it should be versus being what it has been for the last 30 years? I don't know.
So, yeah, you mentioned reform, and you're part of the reform committee. So the idea is hopefully that you're coming up with some reforms. But you also mentioned demographics, that there are more 65 and older than there are in K-12. And then there's the workforce shortage. So do we do it differently? How can we do it differently? I mean, just before we were talking about these buildings and these institutions, and do you have ideas on that?
Yeah, I think you talk about population is changing, yet, we in the last previous years haven't had so many new people coming to Minnesota to work in that industry. So part of it is, how do we get more people to come in to work in that industry? How do you create a career lattice or a career ladder that says, come in, work in this industry, we're going to give you credit, we're going to get you education, we're going to get you to where you want to be, right? It's kind of interesting. You look at what's the name of the big, when you buy stuff online, what's the name of that company, that big company?
Amazon?
Amazon, that's it. Amazon says, come to us. If you want to be a doctor, we'll help you go to school to be a doctor. But they're saying, come to us. that's a great incentive. If I know that I'm going to have flexibility to work when I want to work, go to school when I want to work, and still not worry about having a job, but you're going to take care of that, that's a heck of a marketing idea. And that's to get people to be attracted to go to them. Where's the innovation in Minnesota? I haven't seen it, you know?
Does Minnesota need to make a really concerted effort to bring in more immigrants? I mean, historically, immigrants have done the work that more established Americans don't want to do. They built railroads, they work the mines, they, pick crops. Do we need immigrants to work in our healthcare and nursing care industry?
It's interesting because my grandfather, who came from Odessa, Russia, he worked on the railroads. That was his whole life, was with this little small company called Burlington Northern, and it's just like, he came in, got on that, and stayed there throughout his whole. He was a yard master when he retired. But absolutely, right? And it's like, because it's the old sociological argument of the pig and the python, right? And I just remember visually seeing as it moves through, the population is moving through, right? And so the case of now we have more people 65 and older than we have in K-12 education. Well, what does that tell you? 5 or 10 years from now, we're going to have an issue, right? We have an issue now. We knew this when we first came in 2013, started talking about the silver tsunami. It's coming, right? Nobody was doing anything about it, right? We just kept saying it's coming, it's coming, it's coming. It's here. Not only is it here, but it's right now getting us to our face. And that's why all of a sudden you have the governor coming forward saying, $36 million. And I love this. And then he puts 2.6 or 2.5 million, directly to help bring the National Guard in to help out, right? That's not a long-term solution. It's an easy fix right now, but the long-term solution, what's the industry doing collaboratively with other people to talk about where do we need to be, where do we need to go? And sometimes you got to set aside some of your egos, and sometimes you got to set aside, well, I've done it like this for 40 years, right? What's new for me to do it? I don't know. Somebody has a good idea out there.
Well, silver tsunami, COVID, we have this federal mandate. There are workers who are saying, I am not going to get vaccinated. I will leave my job. And in greater Minnesota, where vaccination rates are lower, this is fairly critical. In your view, did the federal government make a mistake by sort of drawing this line in the sand? Are they playing chicken with the care of people, particularly in rural areas where vaccination rates are lower?
Are they laying the egg to help build the system, or are they playing chicken? I don't know. I mean, sometimes we always wonder, is the bureaucratic response based upon a bureaucratic response, or is it based on science? And so I beg the question, if it's based on science, then we should be following science. Don't you agree? I think a lot of people say, let's follow science. If science is telling us that mask wearing is going to mitigate the chances of you pulling something in from the air, makes reasonable sense to me to wear a mask, right? My wife works in early childhood, and she's around kiddos all the time, and little kids, they're in your face, right? She's not only masked up, but she's double masked, right? Just because of the fact that you just don't know. Last year when we were wearing masks, all of a sudden we didn't get the flu. Why didn't we get the flu? It's because we weren't sucking in all that, energy and air that was out there, right? It was being filtered. So there's some science that, I'm just talking anecdotally, right? But if there's science behind that, then let's follow the science. But here's the thing that I think happens in bureaucracies. And I spent 10 years of my life working in a bureaucracy, both on the state level and on the federal level. And a lot of times we will get so fixated that we don't have any flexibility. And I don't know why that occurs, but is there any flexibility within that scientific argument? Is there any flexibility that needs to be there? Well, then let's talk about that flexibility, if there is any flexibility.
Senator John Hoffman, it's always a pleasure to talk to you. Thank you.
Great talking to you.